Hi, this is Dr. Derek. I'm here at a seminar in Atlanta, Georgia. I'm with two of the top doctors in the world who are experts in the field of extremities. They have people from all over the country and all over the world that come to see them. I've learned incredible new techniques today that help with carpal tunnel syndrome, elbow problems, rotator cuff issues, hip problems, knee problems, plantar fasciitis, foot problems. It's been an amazing day, and I look forward to sharing this information with my patients here with you. And a lot of things I learned today is that, just like I always tell my patients, is that a lot of times where the pain is, that's not where the problem is coming from. It's coming from a different area. So you got to look at the person globally. So if you had a condition that you've not been able to get help, it's often due to if you're just treating the area of pain, that's not the site to work. So the things that I learned today have been incredible. One thing that I want to leave with you though today is that the key to not having pain is motion. You got to have good motion in the joints, in the spine, and through exercise. You got to keep moving. Anytime you stop moving and are stagnant, it's going to affect your health in a negative way. Anyway, the stuff that I learned today, I look forward to helping you and sharing more of this stuff in the future. Thank you very much. Hi, Dr. Derek. It's Monday afternoon, and I just shared some previous video from the seminar this past weekend, which is a great seminar. I told you I wanted to share some information with you. Well, no better time than the present. I'd like to share some things with you in regards to knee pain. Knee pain is one of the most common conditions that I see here in my office, other than back pain, neck or headaches. But in regards to musculoskeletal, knee pain is so common, and it has affected so many people. And there's a lot of, when people treat the knee pain, they make the mistake of focusing primarily on the knees. So as I said earlier, you have to look at the person globally. But one of the first things you want to do, there's 5 things you want to do when you want to address knee pain. I'm going to share with you at least 2 of them today in this video. So one of the things that you want to do is you want to look at your shoes. The shoes that you're wearing make a huge difference whether or not you have knee pain. So most people's shoes are not giving their knees the proper support, or women that are wearing heels, this is just bad news for knees. So if you're wearing any type of heel, it's going to affect your knees in a negative way. But if you're like looking for a tennis shoe, I'm going to give you some tips here in finding a right shoe here. So this is a good example of what you want to look for in a shoe. This shoe happens to be a New Balance. So when you're trying to pick out the right shoe for any shoe, there's some things you want to do. So first thing you want to do is you want to put one hand here and the other hand you want to push in here. When you push in, it should bend at the toes, not in the middle. So it should bend at the toes. That's a sign of good support. The next thing you want to do is you want to twist it. So when you twist it, it should be firm. It shouldn't be where it's super flimsy. It should be a firm in the base there. And then thirdly, you want to look at the bottom of the shoe. Make sure that it's flat. It's not curved. If it's curved, think about it. It's going to be extra stress on the knee. So you want this to be flat. And so and then fourthly, what you want to do is you want to put the shoe on, and then once you put the shoe on, stand on one leg like this and close your eyes. You should be able to stand here forever like this without wobbling all over the place. If you're kind of always leaning to one side or wobbling and you're imbalanced, that shoe is creating imbalance, is going to put more stress on the knee. So there's one major thing you want to look at if you have knee pain. Look at the shoe. And by the way, you should be wearing, most people need a corrective orthotic inside their shoe to help balance out the arches, because most arches are flat and not properly supported. So I recommend a good orthotic here to put inside your shoe. So the second thing you want to do in regards to knee pain that you can do is when people deal with knee pain, mostly like I said, they're treating the knee. You don't want to treat the knee if that's not the primary area that you want to treat. You want to look for the primary cause of the knee pain. So for example, I was at the seminar and I was talking to this doctor, big guy, you know, we're talking in the hallway, and he keeps shifting and moving, and I could tell he's in pain. I said, Doc, you look like you're in pain. Why don't we get rid of this pain here for you? And so he said, okay. So I did an evaluation on him and find out he played college football. He took a lot of shots he played fullback. So I figured playing fullback in football, you're going to take a lot of shots from linebackers in the hips. So first thing I wanted to look at was the hips. And sure enough, we had some major adhesions in the glutes and in the hips. So we worked on the hips and the glutes and the knee. We worked on a bunch of different areas, but he felt a whole lot better. I'm going to show you a sample of what happens when we use a Taylor method with knee issues. We get phenomenal results if you can find the primary cause. But one of his areas was in the glutes. So if you're having knee pain today, you may or may not have problems in the glutes, but if you do, here's a simple technique that you can do to help break up some of the tension in the glutes. So what you do is just get a tennis ball. Get any type of tennis ball. It doesn't have to be new, it could be old. Like this one's a little bit older, doesn't matter. And what you do is you're gonna get a tennis ball and you can stand against the wall like this and kind of dig into it. Now, you don't wanna put too much pressure where it's painful or it's exacerbating or aggravating the area. Just kind of lightly put your hips into it. It kind of breaks up the tightness in those glutes. You can also do it lying on the floor. Hold it for like 5 to 10 seconds. And it's a wonderful form of massage therapy, and you can do it to your pressure, but don't go too hard because you can aggravate things. Once you're done doing that tennis ball technique, I want to give you a stretch that you can do that's critical here for the knee, as well as this is a good low back stretch as well. I give it often to my patients. So let me show you how to do this. You're going to just put your foot your leg in an L-shaped position, and you're just going to go like this. You can be on the floor. Right now I'm on the table it's just more convenient, but you can also do this on the floor. Legs in an L-shaped position, and you're just going to kind of lean forward. So you can do that after you do the tennis ball stretch. And this is a great way to release that hip, and that can take a lot of pressure off of the knee. So the right shoes, working on the glutes, are two great ways to help bring relief to the knee if that's what's causing it. Hope this video has been helpful, and enjoy the testimonial. Thank you very much for being a patient who wants to get to the root cause of the problem, because getting to the root cause of the problem is the key to getting rid of knee pain. Thank you very much.
Hello, I'm Dr. Sluice, and I just got worked on by Dr. Derek. I worked on my hip and on my knee. Fabulous results. My pain level started off at between an 8 and a 9, and it's gone down to a 0. I've been suffering with knee pain since 1991 when I tore my ACL. I've been on and off chronic pain. Feels wonderful. Looking forward to more treatments when I come visit them. Thank you.